Hello,
Hello, how are you, Sarah?
I'm good. How are you?
I'm good, thank you.
So, this is Judith Hirsch. She is a child psychiatrist and works at South Oaks Hospital. Um, what has your experience with PTSD been in the past and in your current practice?
I work in a clinic that serves mostly patients in eastern Nassau County and Suffolk County. A lot of my patients have been impacted more by natural disasters than, um, and they have acute symptoms of PTSD. Um, so for example, things in the past, such as tornadoes and flooding, have happened on Long Island. Most recently, obviously, Hurricane Sandy's happened, and those are kind of patients with very acute symptoms of PTSD. They may have kind of typical symptoms where they have nightmares of the event that happened. They have flashbacks. They re-experience the event. Um, Sometimes they have frequent memories of the event, or sometimes you'll see them kind of recreating the event. So, for example, I had a 10-year-old boy that I was working with who had witnessed a tornado, which is very rare to happen on Long Island. But as a result, anytime he experienced any kind of storm, he became very, very distressed. He was actually attending a camp I was working on, and the camp trip was going to the fun zone, which is where this tornado was. And I ended up sitting on a bus with him, trying to get him to work through his fear that the tornado would come back if he went to the same place. Um, so that's kind of an event that can happen. But most of my patients who I see with PTSD really don't have it caused by a specific single event. They really are the result of being repeatedly abused. Either they've witnessed domestic violence, often they've been severely neglected by a caregiver. A lot of them are victims of physical or sexual abuse. So that's a lot of what we end up dealing with. And often we don't even know that they have PTSD because they come in for other symptoms. So they'll come in because of depression or anxiety. Some of them end up in the hospital and then they come to my clinic afterwards. And as we get to know them, we start to learn what the situation is, and that underlying this hospitalization and the events in their life was the fact that they were severely traumatized.
Thank you. That was. Are there any, and you sort of also tried a particular case study too. That was at SINFA.
Yes, it was. Exactly.
Um, are
I
there
actually
any?
have a patient right now who I never see because she had flooding. She lives in a home on Long Island. And every time she's come to see me, somehow it always looks like it's going to rain, so she won't come to see me because she's terrified of thunderstorms. So it
Oh,
can be very disabling, that kind of thing. But as I said, the most common thing that happens are these kids who've been traumatized. And one of the things that happens is it can cause such severe distress in these children that they look like they're suffering from depression, with terrible anxiety. We've even had kids who've experienced psychosis, and you find an underlying trauma. I actually have another child who I actually saw today who is 14 years old. He was raised by a mother who was schizophrenic with his older brother, and both boys are now living with the father. But when they were living with the mother, they were severely neglected. Um, they never went to school. They kind of got food when they wanted to, and there's a question of how much further they were physically and sexually abused, but we're not exactly sure. But what this boy does is he does something called dissociates, and that's another way that people can deal with their trauma. So what he does is he doesn't um, he'll zone out. So when he becomes very anxious or concerned about something, he'll zone out like he's not there. So he actually said today that he remembered the first time he did that at the house that he's living in now was when he first moved in, and he was told that he was supposed to clean a room up with his stepmother. And he said because the stepmother was really a stranger to him, his defense mechanism was blown out. So that's what he did. So part of the treatment for this child is not only addressing his academic needs, and he does have academic needs and some learning issues, but also addressing the fact that he has to learn how to trust people again, has to learn how to deal with his anxiety and not to experience the trauma. So what makes it really complicated at times is that his mother has now reappeared in the picture, and she wants him to come to her house. And part of the discussion that happened with the family today is that's not a good idea because it's going to bring up the memories of the trauma that happened before, and he's not over it enough to go back into that situation. So that's part of what we need to do as far as treatment goes. I know you guys are talking about cognitive behavioral therapy too, which is a very important part of the treatment, which is really changing the way somebody thinks and their thought processes, and that can be very effective in dealing with this and dealing with anxiety and depression. As a psychiatrist, I end up using medication a lot because that's really my role as part of our treatment team. So I often treat patients with anti-anxiety medicines or antidepressants. Some of the kids, because they're in so poor shape, end up taking major antipsychotic medications, which they need to do to really help them be able to function. It's a kind of a combination approach that we use to try to deal with these kids who are really quite damaged and try to help them to be able to succeed.
So would the psychologists in your clinic do the cognitive behavioral therapy?
Yes. So we actually don't have a psychologist yet. We have a new one who should be starting. But our social workers are also trained in cognitive behavioral therapy. So the therapists see the patients and they do the therapy with them.
Okay. Do you see any gaps in the current treatment in terms of what is used most commonly, or like access to care? Is that an issue that you face a lot?
Access to care is a huge issue. I'm so glad you asked me about that, because one of the problems that we have is that there are so many kids with mental illnesses in the country. And just to give you like a perspective, I'm a child psychiatrist. There are 10,000 to 15,000 of us in the whole country. Where I work on Long Island, it's very difficult to get access to care. Is really a problem. My clinic was started because we had a lot of patients who did not have insurance or had Medicaid, had lower insurance. Actually, they have to have insurance to be in the clinic. So they have Medicaid or they have insurance that doesn't pay a lot of money, and there's very few doctors who will take that and clinicians who will take that. We are actually involved in a very exciting program called Integrated Care, which takes place in physicians' offices. And the idea is, just like I'm talking to you today, I do telehealth consults, and I see patients over the internet, and I do consults in the pediatrician's office on the patient. And the goal being that the primary care doctor will be able to do the prescribing. So that's what we're trying to do. There's a nationwide movement to try to help primary care pediatricians and family practice doctors treat these patients and not only treat them, but recognize the illnesses in the first place and the distress that they're in. We actually currently have a therapist embedded in 2 pediatric practices. So they actually have very nice warm handouts from the doctor's office to the therapist, and then I get involved when they feel they need me to get involved to do consults. So it's a really major problem. I know one of the things that a lot of people ask about is what's the situation with Hurricane Sandy, since we're on Long Island. And I think people don't realize how much Hurricane Sandy impacted families on Long Island. But I continue to have families that have not gotten back into their homes. I have one little boy whose family was living in a hotel up until 2 weeks ago. Finally got back into their home. And interestingly enough, what happened to him was he was doing okay when he was living in the home, and not in the home, in the hotel. And there were so many kids who were displaced from his district that they actually gave them, they had a bus, and they called it the displaced bus. And they would pick up these kids and take them to their district school. He was doing okay, but interestingly enough, he started to have more problems again and get more anxious when he got back home. And it kind of makes sense if you think about it, because home is where he had to be evacuated from his home. So it kind of makes sense that if you've been traumatized and then you go back to the place you were traumatized at, you're going to become more anxious. And that's pretty much what happens with kids with PTSD, is when you remind them of the traumatizing event, their symptoms can be worse. And that's why it's so important to do the cognitive behavioral therapy. I like to think about it as giving the kids a toolbox. You know, they have a toolbox. They can get their strategies and their coping skills and things that they need out of their toolbox whenever they need them. And that's going to help them no matter what they experience in their life. More questions?
Yeah, I just thought of a couple others. Have you had any? Have you tried to collaborate at all with schools in terms of helping the kids recover and working with their teachers or the social workers at the schools?
We're not involved in that currently directly from my clinic, but we actually, part of our integration process is we actually have therapists embedded in some of the schools too in the area. So they're doing that kind of work in the school. And I've had a lot of experience working with schools in the past.
A lot of experience, did you say? I just didn't hear that.
I have a lot of experience in schools. I used to run a program in a school, and actually I was working in a high school during 9/11, on September 11th. So that was a very difficult experience, but it really taught me how important it is to be there with the kids in the present where they are at. The kids, you know, they're home, they're in school, they do come to their pediatrician's offices. It's not so normal for them to show up in a psychiatrist's office. Often there's a stigma attached. But if you can see them in the school where they are, you can do really more effective work. So that was a place where I really got to do some of that. We were very lucky that very few of our students were directly affected by 9/11, but everybody was affected because it was such a traumatic event for the New York area. So, you know, that's something that's really very important. And I think social workers and psychologists in school are really on the front line dealing with these issues.
Do I have any more questions? Wow, those were such good answers. Anything else you would like to share that you feel is important?
Oh, I think that we pretty much covered it. I think the big message is we need more people who want to work with kids and help them in troubled populations. And it's just very, very important that we do that. And that we get the message out that these children are out there, they're not getting the help they need, and we need more people who are skilled in doing this what CBT is it's an evidence-based treatment. And we need more and more evidence-based treatments because they're more short-term, they're effective, and we need practitioners out there who know how to do them. It's very important.
One last question. I just remember you talking about how children with PTSD will sometimes act things out through play, and I thought that was particularly interesting. So can you tell me a bit about...
To answer your question would be more like the idea that you'll see them, like in the clinical office, you'll see them, the dollhouse is a really good example. So often they'll act out a family, what's happened in their family. So you'll see them, you know, having some child being hit or abused by a parent. Often you'll see them act it out. It's their way of expressing what happened to them.
Okay. I'm going to now end the broadcast.